Hi, it's Evan Kirstel here with eViRa Health out of Boston. Delighted to chat with a couple of fascinating people today. Firstly, Irma Rastegayeva of eViRa Health. Hi, Irma.
Hi, Evan. Hi, Tim.
And our guest of honor is Tim Washburn, Chief Clinical Officer at Electronic Caregiver. Tim is, among many other distinguished things, a nurse of 25 years, a nursing leader, and a leader at Electronic Caregiver.
Good to see you. Thanks for having me.
So help us understand the landscape of telehealth, in particular aging in place. For me, it's a little confusing. There are a myriad of devices,
Sure.
and apps and services and technologies. How do you fit in this landscape?
There is an app out there. There's thousands and thousands. What we've seen is that when it comes to chronically ill, which is one segment of the population that we work with a lot, the elderly chronically ill, they're certainly a key component. By no means the only component. That for those folks, they don't like apps. If you give an 82-year-old with diabetes and glaucoma a smartphone and you let them know all they have to do is periodically pair their glucometer to their smartphone, and then flip through the apps to find the right one to actually upload the data. If you're my mom, who is that human, she's just going to slap you in the head and throw away the device. So what we really come to understand is the concept of a universal technology is really mythological. It's a very bad idea because it turns out it doesn't work. If I'm the elderly, I want something very simple, something I can turn on a device, take my vital, it connects automatically, it gets the data in. I don't have to do anything else but turn it on, take my vital, I'm done. When I say turn it on, I mean hit a button that turns it on. Like, it's not fancy. Now, certainly, as we've seen the population age, we're seeing technology more accepted over time. Point is, there are certain apps with the right user interface, and we're creating our own. Addison, the virtual caregiver, is absolutely an app-based system, but it's so much more than that. The concept is have that app as a technology, but make sure that your user interface, the way you engage, all of the things that matter are actually easy to use. Again, the KISS principle, right? We love it as clinicians. We only have 3 questions for you, all you technology companies. How much does it cost? What do I have to do? And what exactly does it do for my patients? So we have a lot of technology out there that ignores all those 3 questions and just talks about features that may or may not even work. Electronic caregiver, we've reversed that paradigm completely. We actually start with those 3 questions. I mentioned earlier, it's not about a one-size-fits-all solution. It's about understanding what a given customer needs. It's the age of the consumer after all. And when you start there, you can actually create some really cool, nuanced, agile, custom solutions that do amazing things because they do something important. They actually work. And that really is the difference between technology and our solutions. So yes, it is a form of technology. The box, that's a doorstop. It's everything around the box. It's everything about the interface when you use the box or whatever system. And what I would tell you is that if technology feels confusing to you, you're probably talking to the wrong people. Turns out it doesn't have to be all that complicated. It can be very good and very easy to use. And certainly, if you want to understand how we can help you with that and you want to demystify that, please call me. We do it every day, thousands and thousands of times a day.